Hi, welcome to the Lifestyle Herbalist, the podcast where holistic wellness meets everyday living. I'm your host, Dabney-BS. I'm a registered dental hygienist, a clinical herbalist, and a certified health coach.
And I'm your co-host, Sabrina Cooper, a registered dental hygienist with a bachelor's in oral health promotion, a certified culinary nutritionist and herbalist, and a mindfulness and mindful eating coach. Together, we explore the intersection of holistic health, herbal wisdom, and joyful living. From plant-powered remedies to kitchen medicine, mindful moments, and conversations that feed the soul, we're here to help you feel vibrant, grounded, and inspired in your daily life. So steep a cup of something soothing, settle in, and let's grow well together one episode at a time, bringing you a healthy dose of happiness. Hi everyone, and welcome back to the Language of Symptoms. As promised, I'm here with episode 2. And today we're going to talk about headaches, jaw tension, and what your nervous system is saying. If you have ever said, I carry all my stress in my jaw, or I wake up already clenching, or I get headaches even when I'm doing everything right, this episode is for you. Because headaches and jaw tension are rarely about muscles. They're often about how safe your nervous system feels. So today, we are decoding one of the most common and most misunderstood symptom patterns in modern health. And once you hear this, you may never think about headaches the same way again. Let's start with an important truth. There are over 150 different types of headaches recognized in medicine. Imagine 150 different types of headaches. But the most common ones are tension type headaches, migraines, TMJ-related pain, and they all share a common thread. And that is nervous system involvement. Headaches are not simply tight muscles or bad posture. They are often the result of chronic sympathetic nervous system activation, altered pain processing in the brain, reduced vagal tone, and changes in blood flow and neuroinflammation. In other words, the body is responding to a perceived threat, not tissue damage. So here's where it gets fascinating. The jaw is innervated by the trigeminal nerve, the largest cranial nerve responsible for sensation in the face and motor control of chewing. This nerve directly interfaces with the brainstem, is highly sensitive to stress, is strongly influenced by breathing patterns and emotional load. Clenching and grinding, known as bruxism, are not habits. They are motor responses to nervous system activation. Your jaw is essentially acting as a pressure valve, and when that valve is consistently and constantly engaged, pain follows. And that's what we call the jaw-brain connection. In the dental field, as a dental hygienist, we often have clients or patients with chronic TMJ issues, and often they present with normal imaging. So we can have a patient with jaw pain, clicking, daily headaches, neck and shoulder tension. Their x-rays or dental imaging is normal. If they have been for an MRI, perhaps because it's very consistent and constant, and they've gone further than just dental imaging, an MRI may not show any structural damage, and they're told, we often suggest wearing a night guard. They may be told to reduce their stress levels. It's helpful, but it's incomplete. And so what is missed is it could be a chronic mouth breathing issue, forward head posture, shallow upper chest breathing, poor sleep quality, elevated baseline cortisol. And research shows that altered breathing mechanics and sympathetic dominance increase trigeminal nerve excitability. Once breathing patterns are corrected and the nervous system downshifts, jaw pain often improves even without a dental intervention. And it's not to say that a night guard or clenching apparatus wouldn't help. It will help alleviate some of the symptoms. But checking in with your breathing and slowing that down may also make a huge difference. Migraines in particular, are now understood as neurological sensitivity disorder, not a vascular one alone. Studies show altered sensory processing, increased cortical excitability, reduced ability to adapt to stimuli. What's that in simple terms, you ask? Well, quite simply, the brain is overwhelmed. Light, sound, smells, stress, they all start to stack. They accumulate. The headache is the brain's way of saying, I need less input. So this reframes migraines not as weakness, but as a protective shutdown. It's being overstimulated, getting too much sensory information, taking on way too much. And so your brain is actually giving you those signals that are saying, whoa, 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 slow down and let me recover because I'm in brain overload. A high achieving professional experiences some migraines. So here's a great example where someone who is in a high stress job is experiencing these migraine headaches. So mostly on weekends or after stressful weeks or during some hormonal shifts. They're eating well, they exercise, their labs are fine, everything seems to be coming back quite clear. But their nervous system never truly comes out of high alert. It's always in that intense go, go, go pattern. When stress finally stops or drops, the migraine hits. This phenomenon is called the letdown effect, well documented in migraine research. The headache isn't caused by relaxation, it's caused by the contrast after prolonged stress. So it's almost like you get that letdown. It's like a pressure headache because your brain has been in so much overdrive that once it stops, it's just like pow, it gets this jolt. And now you have to let it down and it's just trying to readapt to its regular behavior. So oftentimes treatments will fall short. Painkillers can help, but they don't change the terrain. Mouth guards protect teeth, but not the nervous system. Botox relaxes muscles, but doesn't address why they're contracting. Without addressing stress physiology, breathing, sleep, blood sugar stability, emotional load, the signals will keep coming back. We're not getting to the root problem. We're just almost band-aiding the situation because the message hasn't been received. This week, I urge you to notice what if and when you clench. Do you have headaches that appear and when do they appear? What's happening emotionally or mentally beforehand before you experience these headaches? How are you breathing when symptoms arise? And this isn't about blame. This isn't about going, oh my gosh, like this has happened and it's about pattern recognition. And if this episode shifted how you see your symptoms and you start to think, man, I'm getting this now that I am getting these headaches, not because of nothing. There has to be a reason why I'm getting these headaches. Then I want you to share this with someone because understanding everything that happens is for a reason. You'll get to the bottom of why you're having these issues. Your body just doesn't tell you things or things that aren't happening because they're supposed to happen. We're not supposed to live with headaches and migraines and discomfort and tension in your jaw. No, everything is supposed to just go flow together and you're supposed to feel alive, for lack of better words. So I really want you to pay attention this week to see if you have an onset of a headache, why it's coming on. Check into your breathing patterns, your hydration levels, the foods you're eating, anything like that if you've been in high stress situations, and pay really close attention. And then once you figure that out, see if you can address those situations, make some little tweaks and changes, and see if you can go with a period without those headaches. And you might be pleasantly surprised. So this short little episode is these little episodes are just to give you little tidbits of information, little bite-sized nuggets that you can take on and use them at your discretion. Kind of start to investigate, be your own detective of your symptoms and your signals that your body's giving. The next episode, I'll be decoding gut symptoms like bloating, reflux, IBS, random food reactions, and how your nervous system and immune system are deeply involved. Because once you learn the language, your body will make a lot more sense.